And there are two plants that have proteolytic enzyme. One is the pineapple, and the pineapple has bromelain in it, and that is a proteolytic enzyme. And the papaya has papain in it. So proteolytic enzymes break down protein. So your proteolytic enzyme is trypsin and trimotrypsin and pepsin. And these also are proteolytic enzymes. The good news is you can buy bromelain and papain in a tablet form, a concentrated form. And I personally would prefer someone use the lemon juice or the cayenne pepper because it boosts your stomach to make its own. But if someone has pancreatic problems, pancreatitis, pancreas that is cancerous, they need the proteolytic enzymes. Many people with pancreatitis or pancreatic cancer die of malnutrition. Can you see why? Because the pancreas is the main organ of digestion.
Pancreatic cancer is known as a silent killer because it is often caught late, so paying attention to symptoms is crucial. The pancreas sits behind the lower part of your stomach, and this is where pancreatic cancer begins. This type of cancer is serious because it's difficult to detect early, making treatment more challenging. The symptoms are often mistaken for more common, less serious issues, so being aware of them is key. In this video, we're going to cover 10 warning signs of pancreatic cancer that you shouldn't ignore. Think of these signs as signals from your body that something might be off. Catching these early could make a huge difference, whether it's getting treatment sooner or simply feeling better down the road. Our channel is also giving away 100 free copies of Barbara's best-selling book. To enter, simply hit that subscribe button, like this video, and comment why you want to win.
From the duodenum, the pancreas also releases some enzymes in there. And the pancreas releases pancreatic lipase. And pancreatic lipase does the final breakdown of the unsaturated fats. They're the long-chain fatty acids. So bile starts it, pancreatic lipase finalizes it. The pancreas also releases pancreatic amylase. And remember, ptyalin is a salivary amylase, so the amylase salivary amylase ptyalase starts the digestion, put on hold in the stomach, comes to the duodenum, and pancreatic amylase finalizes the starch digestion. What's also released in the pancreas is trypsin. And trypsin is the enzyme that finalizes protein digestion. So protein digestion is begun in the stomach and finalized in the duodenum under trypsin and chymotrypsin. So these are two enzymes that break down protein. I've got some good news. It's going to get easier now. They're all the big words. From this, students, what's the main organ of digestion? It's the pancreas. Most people think that all of their digestion happens in the stomach, but it is not true.
The pancreas is an organ about the size of your hand, located just behind the lower part of your stomach. Pancreatic cancer happens when abnormal cells in the pancreas start growing uncontrollably, forming a tumor. This organ plays a crucial role in producing hormones that manage blood sugar levels and enzymes that help us digest food. One of the tricky things about the pancreas is that pancreatic cancer often doesn't show clear signs until the tumor has grown large or spread to other parts of the body. This is why it's usually detected in later stages, rather than early on. One of the main challenges with pancreatic cancer is that its early symptoms can be pretty vague. Signs like stomach pain, unintentional weight loss, or constant fatigue might seem minor, so people often don't think to visit a doctor right away. Unfortunately, this delay allows the cancer to grow quietly. Being informed about the warning signs can help us take action sooner when something feels off. So, let's dive in. Symptom number 1, loss of appetite. Loss of appetite, or anorexia, refers to a reduced desire to eat. While it can sometimes be triggered by stress or illness, a persistent lack of appetite might point to a deeper health issue. It doesn't just affect your eating habits, it can lead to significant weight loss and nutritional deficiencies, making it harder for your body to recover from illnesses. There are many reasons for a loss of appetite. It could be due to psychological factors like depression or anxiety, or physical conditions such as digestive problems, chronic illnesses, or infections. More importantly, a loss of appetite can be linked to several cancers, including pancreatic cancer. In pancreatic cancer, this symptom can happen because substances produced by the cancer may change how food tastes or reduce the desire to eat altogether. A tumor pressing on the stomach can also make you feel full after eating just a small amount. Treatments like chemotherapy may also decrease appetite due to side effects like nausea and taste changes. The loss of appetite in pancreatic cancer is especially concerning because it can lead to a condition called cachexia, where a person loses a lot of weight and muscle mass even when eating enough. This isn't just about weight loss. There are many complications that can seriously impact a patient's strength, immune system, and overall quality of life. Symptom number 2, weight loss. This happens when you lose weight without trying, no changes to your diet or exercise routine. You might notice your clothes feeling looser or see the number on the scale dropping unexpectedly. While this might seem like a pleasant surprise, it can actually signal a potential health issue. This kind of weight loss can occur suddenly, and it usually means your body isn't getting the energy it needs from your food. There could be several reasons, like burning more calories due to an illness. It can be a sign of conditions such as an overactive thyroid, hyperthyroidism, diabetes, depression, or digestive problems. It's also a common symptom in many types of cancer, including pancreatic cancer. In cases of pancreatic cancer, weight loss can happen for several reasons. The pancreas may not produce enough enzymes to digest food properly, leading to malabsorption and weight loss. Additionally, a tumor pressing on the stomach might make you feel full after eating only a little. Cancer in general also speeds up the body's metabolism, causing calories to burn faster than normal. Unexplained weight loss is something you should always pay attention to, especially if you lose more than 5% of your body weight in 6 to 12 months and notice other symptoms too. Symptom number 3, jaundice. Jaundice happens when your skin and the whites of your eyes turn yellow because of increased bilirubin in the blood. Bilirubin is a yellow pigment made when your body breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile, and then removes it through your digestive system. But when something's not right, the liver might struggle to release bilirubin, or there could be a blockage somewhere in the bile ducts. This can happen because of conditions like hepatitis, cirrhosis, gallstones, or in severe cases, cancers like pancreatic cancer. Jaundice itself isn't a disease, but it's a sign that something's wrong. Along with yellowing skin and eyes, you might notice dark urine, pale stools, or itching. These signs help doctors figure out the cause of jaundice, since treating it means addressing the underlying issue. Recognizing jaundice is important. It's your body's way of signaling that something's off, especially when it comes to the liver or bile system. Symptom number 4, abdominal pain. This is a pretty common symptom that refers to discomfort between your chest and pelvis. The intensity can range from mild to severe, depending on the cause. Since this area houses important organs like the stomach, liver, pancreas, and intestines, it can sometimes be tricky to pinpoint where the pain is coming from. It could be related to an underlying issue and might feel sharp, dull, or come and go. One serious concern when it comes to abdominal pain is its potential connection to pancreatic cancer. In cases like this, the pain often starts in the upper abdomen and may spread to your back or side. It can worsen after eating or when lying down and becomes more constant as the cancer progresses. But not all abdominal pain is this severe. It can also be caused by things like indigestion, gas, or a stomach bug. However, if the pain is really intense, comes on suddenly, or is paired with symptoms like jaundice, unexplained weight loss, or changes in bowel habits, it's important to see a doctor right away. These could be signs of a more serious issue that needs attention. So, don't ignore persistent belly pain, especially if other symptoms pop up along with it. Symptom number 5, digestive issues. These problems can range from mild discomfort to more serious conditions affecting daily life and overall health. Digestive troubles usually involve symptoms like nausea, vomiting, diarrhea, or constipation, and changes in stool consistency, often becoming loose or watery. These issues might be caused by something as simple as dietary choices or stress, but in other cases, infections or chronic conditions like ulcers or gastroesophageal reflux disease can be the cause. One more serious issue is pancreatic cancer, which can disrupt digestion. The pancreas produces enzymes that help break down fats, proteins, and carbohydrates for the body to absorb nutrients. When cancer interferes with this process, nutrient absorption becomes difficult, leading to digestive problems. For example, a tumor may block the stomach, causing nausea and vomiting. Changes in stool, like fatty stools, steatorrhea, can happen when fats aren't being properly digested. People with pancreatic cancer may also experience abdominal pain or bloating after eating because their bodies can't digest food properly. Over time, these digestive issues can lead to nutritional deficiencies and weight loss, affecting overall health and well-being. Symptom number 6, new-onset diabetes. New-onset diabetes refers to the sudden development of diabetes in someone who previously had normal blood sugar levels. This is especially noticeable in adults over 50 years old who haven't experienced major changes in their weight, diet, or lifestyle. Some common symptoms include increased thirst and urination, unexplained weight loss, fatigue, or blurred vision, all of which happen because the body can't properly manage glucose, sugar, in the blood. When it comes to pancreatic cancer, new-onset diabetes can be an important warning sign. The pancreas produces insulin, the hormone that helps your body absorb glucose from the bloodstream into cells. If a tumor affects the pancreas, it may reduce or impair insulin production, leading to higher blood sugar levels and, ultimately, diabetes. While the exact link between new-onset diabetes and pancreatic cancer isn't fully understood, it's thought to be related to changes in how the pancreas functions or how the body uses insulin. In some cases, diabetes might even be the first noticeable symptom, especially when other signs of cancer are unclear or absent. Of course, not all cases of new-onset diabetes are tied to pancreatic cancer, but if someone suddenly develops diabetes without the usual risk factors like obesity, family history, or a sedentary lifestyle, especially if they're over 50, it's a good idea to get a thorough medical checkup to rule out any underlying conditions, including pancreatic cancer. Symptom number 7, itchy skin. Itchy skin is that uncomfortable sensation that makes you want to scratch a certain area. It can be caused by visible rashes or even those that aren't immediately noticeable. While it's often mild and temporary, ongoing itching could be a sign of underlying health issues that shouldn't be overlooked. One unexpected cause of itchy skin is related to liver or bile duct problems. The liver plays a key role in processing waste, and bile ducts transport bile, a digestive fluid, from the liver to the small intestine. If the liver isn't working properly or if bile ducts are blocked, bile salts can build up in the bloodstream instead of being eliminated from the body. This buildup can lead to itching, often without any visible rash. This itching might be linked to a blockage in the bile duct caused by a tumor, which disrupts the normal flow of bile and leads to an accumulation of bile and bile salts in the body. Itching often accompanies another classic symptom, jaundice, which is the yellowing of the skin and eyes resulting from the same bile duct blockage. This is a strong indication that there may be an issue with the liver, bile system, or pancreas. The itching associated with conditions like pancreatic cancer or other liver diseases tends to be more widespread, chronic, and progressive compared to the localized itching that can occur with dry skin or eczema. It also often worsens at night, affecting sleep and overall quality of life. Symptom number, fatigue. Fatigue is a common symptom across various conditions and often presents as a persistent feeling of overwhelming tiredness, weakness, or exhaustion that doesn't go away with rest or sleep. While many people experience fatigue that improves with a little downtime, chronic fatigue without a clear reason could indicate an underlying medical issue. It's important to understand that fatigue goes beyond just feeling tired. It can mean lacking energy even after resting, and this can have a significant impact on daily life and overall well-being. For instance, in conditions like cancer, fatigue isn't simply a result of energy expenditure and often doesn't improve with rest. In pancreatic cancer, fatigue can arise for several reasons. Cancer cells compete with healthy cells, leading to malnutrition, which can contribute to feelings of tiredness. Issues like poor appetite and digestive problems can further limit nutrient intake, making fatigue worse. Moreover, the emotional challenges of coping with cancer and the stress it places on the body can leave someone feeling drained. Treatments such as chemotherapy can also bring side effects, including fatigue, which adds to the exhaustion associated with the disease. Symptom number 9, blood clots. A blood clot is a gel-like mass that forms in your veins or arteries. These clots are a natural response when you have an injury, helping to seal off the wound and prevent further bleeding. However, when blood clots occur without a clear injury or don't dissolve on their own, they can be a serious health concern. This can lead to conditions like deep vein thrombosis, where clots block blood flow in the leg veins, or pulmonary embolism, where a clot travels to the lungs, which can be life-threatening. Blood clots can sometimes signal underlying serious health issues, including certain types of cancer, such as pancreatic cancer. Cancer cells can release substances that promote blood clotting, and some treatments for cancer may also increase the risk of clots. In the case of pancreatic cancer, the disease can not only restrict blood supply to the pancreas and surrounding areas, but also make it more likely for clots to form. If a clot travels to the lungs, it can cause sudden shortness of breath. Other signs of a blood clot include swelling, pain, and redness in one of your limbs, especially in a leg. Symptom number 10, changes in stool or urine color. Changes in the color of your stool or urine can give you important insights into your health, highlighting either minor issues or more serious conditions. Typically, stool is brown due to bile, a digestive fluid made by the liver, while urine usually ranges from pale yellow to deep amber, depending on how hydrated you are. However, significant changes in these colors can be a sign of health problems. Dark urine can often be a sign of dehydration, suggesting it might be time to drink more water. But if your urine remains dark despite staying hydrated, or if you notice blood making it pink or red, it could indicate liver issues or urinary tract infections, among other concerns. Similarly, changes in stool color can point to health issues. For instance, light, clay-colored, or white stool may suggest a blockage in the bile duct, which can be caused by various factors like gallstones or tumors pressing on the bile duct. On the other hand, very dark or black stools can sometimes be a sign of bleeding in the upper gastrointestinal tract, which could be linked to issues like ulcers or even gastric cancers. When it comes to pancreatic cancer, changes in stool or urine color are important to watch for. The pancreas plays a key role in digestion, and it also helps regulate enzymes that break down food. If a tumor blocks the bile duct, bile can't reach the intestines. This can lead to lighter colored stools and darker urine. This blockage also affects fat digestion, which may further change the appearance of your stool. If you've noticed some of the symptoms we've talked about today, like unintentional weight loss, a shift in appetite, or anything else that seems out of the ordinary, it might be time to check in with a healthcare professional. Your body communicates through symptoms, and catching these signs early can make a big difference. Don't wait or ignore them. Your health is too important to leave to chance. Regular checkups with your doctor aren't just about staying informed. They could help identify a problem before you even realize it's there. Setting reminders for monthly, quarterly, or yearly visits can be a simple way to stay on top of things and keep your health in check. If you found this helpful, don't forget to like the video and subscribe to our channel. You're not only taking care of your health, but also helping to spread awareness. Your health is priceless, so listen to your body and take action when needed. Let's work together toward a healthier future.